Hey guys, this is Greg with Medical Muscle. In this video, I'm going to talk about pediatrics. And this is part of a series where I talk about each of the specialties that I did in my core rotations. So let's get into it. Pediatrics is a tough rotation. It's tough and it's very important on step 2. It makes up, I think after surgery, it's one of the highest. It can be the third highest. It can be in content. So it's important to cover it, and it's hard. It's very much like internal medicine. You know, there's a wide range of conditions, but I think in pediatrics, there are some unique things that are really challenging, like vaccinations. You need to know all those. You need to know all the infectious diseases that the pediatric population can be affected by that are not as common in adults. You have to know all the genetic conditions, because usually that's when these present, is in the pediatric population. Because then, you know, if they're treatable, usually, you know, it won't be an issue as they get older, like lupus or type 1. Usually it presents in the pediatric population. So you have to be aware of those things. So how did my rotation go? So I had basically 3 weeks of inpatient. In the 6 weeks, I had 3 weeks of inpatient. The first 2 weeks were just regular floors. You get in at 7 a.m. You chart check the patient, usually a little bit before 7 a.m. Chart check the patient, see if there's any updates, and then go and talk with the patient, do a pre-round, see if they can speak. If they cannot speak, you talk with the parents, figure out if there was any updates, right? Then you would, obviously do your physical, and you want to do a directed physical. There's a lot of MSK things that you also have to hit, which I thought that was interesting. A lot of hip pathologies, so you have to keep in mind. So go and talk with the patient. Then I'd go back and prepare for my presentation during rounds to the attending, as we go through. And then after that, we'd have lunch. Then I would go back and maybe see them one more time and then write the note. And I think at the most I had 3 or 4 patients. 4, I think, at the absolute most. So it was busy. I mean, you're working pretty hard within that gap between 7 and noon, roughly noon, okay? You're going nonstop. But then after that, it was kind of chill and I had plenty of time to study. Now, studying for this rotation, you need to study your butt off. It's a tough exam. There's a lot of content in a very short period of time. Okay, a lot of things to cover. All those vaccines, all those things. You got to know all that. Okay, it comes up on the shelf exam. So I did that for 2 weeks. One of the weeks of the 3 weeks of inpatient was the epilepsy neurology department. I thought that was very interesting. It was a little overwhelming seeing a patient have an active seizure. Yeah, that was interesting. But I felt like I learned a lot during that rotation. So the other parts of the rotation, that was the harder part. This is the slightly easier part. Well, I guess I could say the inpatient usually were done, no later than 3:30 sometime. Well, that was on the early side. Oftentimes it was closer to like 4 or sometimes even 7 o'clock. We had some long calls, so I just want to clarify that. Now, the easier parts of the rotation, we had outpatient. Very chill, okay? So I would go to this little clinic. I'd have to drive there. And it was just one doctor. He owned the business, but he worked for the hospital. He was a branch. And I would just go see him, and him assessing babies and, neonates. And basically it was their first, pediatric appointment. It was very interesting. I actually got to talk to him a lot about what it's like to own a business. It's just him and 2 nurses. So I thought it was very interesting. And his wife was there to help. Really nice guy. So it was interesting. A very short day. It was only like a few hours. Then I was in the emergency room, the pediatric emergency department. We did, you would be emergency room shifts, it depends on, what your time schedule is. We didn't have to do any overnights. I don't know why, but we didn't have that. So we did, the early 7 to 3 or the 3 to 11. It was one of those 2. And I think there was a third one, something like that. But it was like some odd hour shifts. that was very interesting. I saw a lot of conditions that I had studied in medical school and hadn't seen in any other rotation. So lupus, all the hip pathologies, I saw almost all those. You know, a lot of sick kids. It can be overwhelming, especially you're trying to get information from the parent and they're stressed out, you know, and you know, is it something that you should be, are you concerned about the safety of this baby, or is this just nothing, right? Are you going to send this kid home? It's a little tedious. You need to make sure to hit everything. If you have any weird feelings, then, you know, say it. If you feel like, you know, something needs to be said to an attending, you feel like this kid is not doing as well as you think, you need to speak up. Okay, but I felt like the attendings were really smart, very smart. You have to be, and very physical heavy, because you have a patient that can't really speak, right? I mean, a baby can't speak, so you know, physicals are very important. You know, bring your stethoscope, maybe a little stethoscope. All right, and then the last part of the rotation, which was very chill, was the neonatal department, right? So babies are just getting, you know, being held right after being born, and you get to do physicals, like the routine physicals, like checking for hip dysplasia, checking the reflexes, making sure everything's intact. They're little babies, so it's everybody's loving it. You know, they're very cute. All the ones that we dealt with were all healthy. You know, they're just going through routine physicals. So all in all, it's a very tough rotation. I've talked with many students in many different locations, different hospitals, and they all kind of say the same thing. It was one of the hardest rotations they experienced. The hours while an inpatient were pretty intense. The workload while you were there was pretty intense. You know, in the emergency room, you're moving nonstop as well. So I think, you know, you really have to be conscious of how many questions you're getting in a day. Seriously. And our school had like a 3-week assessment test, so they have that. All right, guys, please like and subscribe this video. I got many more to come. Hope you guys are kicking butt.